Hello, welcome to this educational initiative by Sattvik Spine and Scoliosis Center. Most of the times, back pains relate to lifestyle factors, the way you sit, the way you work, the posture you have, and things like that. However, there exist certain red flags, certain conditions wherein it would be better to consult with a spine surgeon at the earliest. Let's see what are those over the next few slides. As long as the pain remains restricted to this red area alone, generally it does not indicate anything serious. But if it starts going down into the hands or the legs, and that too asymmetrical, one side more than the other, that could indicate something serious. If the duration of pain is longer than 3 months, again, that is something which calls for attention. Any back pain in an elderly person definitely needs to be evaluated thoroughly. What are the other alarm bells? Sometimes we sit down on the floor for a long time, get up, and we get that sleeping foot syndrome. The entire foot goes numb. That may not be anything very serious. But if you get selective numbness, say only in the index finger and the thumb, or only in the great toe, that could be indicating that some particular nerve in the spine is getting pinched. Most of us are supposed to be having good sound sleep. But if a person wakes up in the middle of the night because of pain in the back, that could be something serious. For example, in this particular case, there's a tumor in the spine leading to that kind of a problem. Most of the elderly people have been recommended to go for a walk to keep their sugars and BP under control. But sometimes, as age advances, there may be pain in the calf or in the buttocks on walking or standing for some time. That again can be something significant, and that needs proper consultation with a good spine surgeon. Unsteadiness while walking. Most of the times we relegate it to old ages, but this could be indicative of some kind of compression in the spinal cord, in the neck or in the mid back, and that can be very well corrected with surgery if taken care of at the right time. Obviously, if there is any significant injury to the spine, you have to have a good consultation with a good spine surgeon at the earliest without wasting time. If there is any back pain in a person who has had history of malignancy anywhere else in the body at any time in the past, that calls for attention. This is a representative case where the person had thyroid cancer some 10 years back, then later on presented with back pain and had a metastasis in the spine. History of fever, tuberculosis contact. Again, these are serious issues which need to be attended to at the earliest. And if attended to at the proper time, they can be managed with simple medicines alone. We are supposed to get up fresh in the morning, but if a person wakes up with a lot of joint stiffness or lasting for more than 30 minutes and present continuously for at least 6 weeks, that could be indicative of some serious condition in the spine called as ankylosing spondylitis. So thank you very much for your attention. Stay healthy. Hope you don't have any spine problems. And in the rare event, if you do need to consult with a spine surgeon, feel free to reach out to us as per the details given here. Thank you very much for watching. Goodbye.